Hi, my name is Aaron Gerds and I'm the editor-in-chief of ASH Clinical News. Welcome to this month's From the Desk of. Well, for our very first issue of 2024, we have a great lineup, topped by our feature article. Our feature article this month is going to look at blood cancers as a chronic diagnosis. And we often think about blood cancers within the context of a very acute disease, like lymphoma and aggressive lymphoma, where you're diagnosed with this disease, you get, say, 6 months of chemotherapy, and then that period of time is over. And then you're on to simple observation after that, unless there's a relapse or a persistent disease. So it can be a very acute event, and an event that is very distinct in its timeline. But a lot of the diseases that we diagnose nowadays are very chronic, where patients can live many years even without treatment. Moreover, a lot of the current therapies can control disease for a long time and don't necessarily put patients into remission, thus making these cancers very chronic in nature. And what's the psychology behind having a diagnosis that you're being told you have a cancer and it's just going to be hanging around for who knows how long, and we're not going to be able to just get rid of it and cut it off really quickly? That's got to really weigh on someone and can really influence treatment choices and the care of an individual. And how can we as hematologists partner with psychiatric specialists in order to care for these patients in the very best manner, both physically as well as mentally, and the interface between the two? For our pASHions section, we're taking a close look at Dr. Aledort and his art collection, which will certainly be interesting and quite visual. And our editor's corner this month features a piece by Dr. Matazar, who goes deep into the MOC world. Certainly a hot topic these days with everything going on with ABIM. And Dr. Matazar adds his 2 cents to the conversation. We also have a book review of Blood and Money by Dr. Cowan, another one of our associate editors. So certainly a good read about a read, if you will. All that is included in the January issue, along with our typical news coverage of articles in blood advances, as well as our literature scan reviews. So we hope you look forward and completely enjoy our January issue of ASH Clinical News. Until next time, keep the blood pumping.